So athletes in chiropractic, we see a good amount of athletes in the office, and even with being a family practice. With the athlete approach, I would say they need it more, because as an athlete, if you look at the best athletes in the world, you know, you take the LeBron James, you take the Connor McDavids, they're all receiving some form of treatment to be able to perform at a high level. And so when we get the athlete from, you know, the local schools or the local area, that's the biggest thing I try to explain, is that the only difference between you and LeBron James, outside of maybe talent for that person, would be pay, right? And care. And so those people take care of their bodies on a daily basis. They perform every day, but as a high school athlete and as a travel athlete, you're gonna perform every day as well. And so my biggest advice to an athlete is, it's not if they can get adjusted. They can totally get adjusted, and they need the care. It would be to have them start before there's an issue. Right. It would be to go on the prevention side, so that when that rolled ankle comes, or when that big hit happens, they've already had consistent care to where their bounce back is way faster.
Yeah, I would agree. I mean, the analogy that I like to use with athletes is, or just anybody in general, is, you know, your body is a machine. Right? Now, obviously, it's not just like a car, right? Because a car it's not living, but it needs maintenance. So if you're an athlete, or if you're, you know, a gym goer, somebody who's more active, you know, you're driving your car, you know, either, you know, harder for more miles, or even off-road. So it requires a little bit more maintenance, right? And, you know, you touched on a good point, like preventive. Like that's the thing that we try to educate our patients on, is like, you know, the time to get adjusted is not just when you're feeling a symptom or feeling your body kind of off proper function, but it's preventative is before that. Yeah. And that looks different for everyone, but for sure for athletes, absolutely. They need it. Definitely, I would say more in the sense of they're going to put their body through a little bit more of the ringer. Yeah. So, and their ability to not only stave off potential injury, even though injury is always, you know, prevalent, or it could occur with anything that you do, their ability to bounce back, you know, faster, right, is not only going to be better for them, but just if they're making money doing whatever they're doing in their profession, yeah, it's better for their livelihood. Yeah. So, and
I guess a question for Dr. Andrew is, you know, with piggybacking off athletes or people in general, are the most common things we see in the office, are they from chronically using something, or are they from acute measures? What would you say?
Ooh, I would. In this office?
Especially with athletes.
Oh, with athletes?
Would you say it's more of a long overuse injury, or is it more of an acute injury?
Chronic overuse. Yeah.
So that's the biggest one.
Yep.
You know.
You bend until it finally breaks.
So getting ahead of that.
Yep.